Patients with coronary artery disease and valve disease are usually recommended for cardiac surgery by their cardiologist after medical management is no longer able to control the problem. Dr. William Thibault of Mission Hospital in Mission Viejo describes the kind of patient who is usually a candidate for cardiac surgery.
Well, mostly the patients that we see have coronary artery disease. They tend to be a little bit older. I think our average age is around 67, but they range in age from the 30s to the 80s and even 90s. And about 20%, maybe 15% of the patients also will have aortic valve or mitral valve disease, either in conjunction with coronary artery disease or on their own. And there are a few people that have dissected, that have problems with their aortas. Either they're enlarged or they're dissected. I think that ultimately the decision is the surgeon's. The patients, though, are pretty well screened by the cardiologist. And if they feel that the coronary disease can be taken care of with the stent or with medical management, or the valvular disease can be treated medically, then they deal with the patient primarily. But if they feel that the surgery will help or is indicated, then they talk to us. And there are occasionally patients that are very sick in that they have problems with not only their heart but their lungs, and have had strokes, or they have problems with their kidneys, which can sometimes make them a poor candidate for surgery, in that the cardiac surgery part would probably go quite well, but the problems that came up afterward with their lungs or their hearts, their lungs or their kidneys, or even their neurological system would be either disabling or fatal. The whole program, from when the patients are admitted and when the cardiologists and the surgeons do their consults, through surgery and the surgical team, to the group of people that take care of the patients afterward, and then even following them after they've gone home through cardiac rehab, is the real secret of a good program and good outcomes with the patients. And if you're missing any of this, then the patients usually don't do as well. I think that certainly everybody should live a healthy lifestyle with a reasonable amount of exercise, eating a good diet, and not smoking. If you put all of those together, that's a pretty good way to prevent heart attacks. I think that if you have a high cholesterol, certainly the statins, a group of drugs that you take to decrease your cholesterol to a reasonable level, has been had a major impact in the last few years on heart disease, and the incidence of heart disease has actually started to decrease, probably due to the statins. And lastly, in the near future, CAT scans, which will be able to actually show coronary disease without having a heart cath, may be the next sort of screening procedure, although at the moment very expensive, to help understand whether or not you have coronary disease, and then if you do, how to deal with it before having a disaster. I think that the object of the operation of coronary bypass or of valve disease, or really of any cardiac surgery, is to get the patients back to where they were before, or even better. And certainly if being tired and lethargic and not being able to do anything is due to the fact that they're not getting enough blood supply to their heart, and you restore this, then this limitation goes away and they can get back to being as active as they'd like to be.